Two healthcare groups in Southern Ontario, Hamilton Health Sciences and St. Joseph's Healthcare Hamilton, are saying that they are seeing unprecedented staff shortages. In a series of tweets, Hamilton Health Sciences said they had 206 healthcare workers isolating because of COVID or illness exposure and 400 posted job vacancies. The group went on to say, quote, "We are aggressively recruiting new staff, but we're drawing from the same pool as other hospitals in Ontario, which are equally pressured." These shortages are happening at hospitals right across the province and, in fact, the entire country. Dr. Greg Rutledge is the Deputy Chief of Staff at St. Joseph's. He joins us this morning to discuss this critical situation. Thanks for taking time to be with us.
Thanks for having me.
As we outlined there, a huge part of this capacity issues is staff shortages. Hamilton Health Services and St. Joseph's Healthcare currently have 675 job vacancies. Where are all the people going? Why is there such a staff shortage?
That's a great question. I think what we're seeing really is the post-pandemic effect here in a way that some people hung on from a nursing and allied health perspective, just felt like they needed to support the hospitals through the pandemic. And just got through the pandemic and said, okay, now it's my time to step away. Others stepped away probably earlier than they would have had it been normal operating procedures. I think the pandemic was a very stressful time for our healthcare workers. We know they shouldered a big burden and got through it and said, I just can't do this anymore. And so took early retirement. Some have moved on to other professions, moved on to other areas, just realizing that isn't the area they want to work in anymore, don't want the continual stress that comes with working in the healthcare system right now. And so all that has led to greater vacancies than normal and an inability during our recruitment strategies that typically work quite well to fill us back up haven't been successful like they were in the past.
How much of it has to do with pay? If the pay were better, if the financial compensation and acknowledgement that comes with that were increased, was improved, would that help?
We certainly hear that from our colleagues, yes. And you made the point. There's payment for sure, and that they're human beings. They want to be remunerated for the work that they do. But I think the recognition piece is a big piece to it as well. The respect, the understanding that all the work they put in through it these last 2 years, and then Bill 124 is a bill that limits their ability to have pay increases. We're going through inflationary pressures that everyone knows, and so they're feeling that pinch like any worker is. And so having that ability to see a pay increase would certainly help. I mean, it's not the only piece of this for all these issues. They're complicated issues. There's not one fix to this, but it would certainly be a piece and a recognition of the work that they've gone through over these last 2 years.
We've mentioned the rise of COVID health cases and officials saying that we are in the middle of this new wave. Weekly Ontario cases are up 28% among those eligible to be tested. Hamilton Health Sciences has more than 206 workers right now with COVID. How bad is this current wave compared to the others?
It's certainly not as bad as the other waves, for sure. We're starting to see the early tips of it. Experts say that we may not see as much in the summer months just because we're outdoors, and so the impact of transmission isn't as great. I think for the hospitals right now, there is a mild increase in the numbers we're seeing. Our admission rates are not going up significantly. Certainly our ICU rates are not up significantly either. I think the biggest impact for the hospitals, again, comes back to human resources. And so we have limited access, already seeing some troubles filling lines. And now we add in COVID illness. And the difference for many of the hospitals versus public systems or private systems is that we don't have that ability at day 5 to bring workers back. So when they get sick, most are off for 10 days. Many hospitals are now looking at that and seeing if we can bring them back earlier if they've had negative rapid tests. But generally speaking, if a hospital worker gets sick with COVID, they're out for 10 days. And so that's just further straining our human resource crisis. And I think that's certainly the biggest impact we're seeing from this wave.
Yeah, and we're seeing it in other health centers as well. In the GTA, they had a hospital having to bring in university students, medical students, to help cover off in the hospital because of the staff shortage. I know it's a busy time for you. I want to thank you for joining us this morning.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.